Welcome everyone to Scholars Dental ACJ course. I'm Dr. Ahmed Hafez, and we're going to begin with an introduction to the ACJ. So let's get started. All right, so what is the ACJ exam? So let's just see what's written first, or what the NDEB says about it. It's a 5.5 hour exam, so you have 5.5 hours to complete the exam with a 30-minute break. You may get anywhere around 120 to 150 questions. Now, these questions, they could be a single answer question or a multi-answer question, okay? So it's a multiple choice question, but you may have one answer or multiple answers per question. And we're going to see an example of that later. And now it's becoming electronic, so it's done on computers and Prometric centers. And yes, some students have had issues with their technology, basically. And sometimes the NDEB will. Last year they redid the exam for students that wanted to retake the exam. So that's going to change from time to time, but it's basically now electronic. You could go to a Prometric center and do a test drive, meaning kind of trying out the platform. And the ACJ also has an orientation on their website. Sorry, the NDEB also has an orientation on their website. So it would be beneficial to actually go and read the ACJ protocol on the NDEB website to get all the details about the exam. That's what you should do before each and every NDEB exam. So you could go to the NDEB website, go to examination, assessments, non-accredited, choose assessment of clinical judgment. And then on this page, you go to ACJ protocol, click on that, and it'll open this area, and you go to this right here. And that will show you the format, the template of the questions, and also some instructions on how the exam is. So it's useful to read these things before you take the exam or before you actually go to the exam. So download the template from their website. Every once in a while, they do change the templates or do some minor modifications to the template, and we always recommend that you have the recent template, and we always teach based on the recent template as well, and we include things from the old templates just in case they bring those options. So the ACJ was mainly split into two parts. One is clinical, or let's say diagnosis, treatment planning, and clinical decision making, and the other is radiographic, okay? Radiographic interpretation. Now, before, it used to be 60 questions of the clinical stuff, where it's all like photos or maybe diagnosis of clinical symptoms. And then afterwards, after you're done the clinical part, you do another 60 questions of the radiographic stuff. However, now they have mixed these together, and it's become a mix. So you get some clinical questions, then you get some radiographic questions. So it's alternating. Okay, and the mocks will kind of represent that and be close to that. So again, it could be a single or multi-answer, multiple choice question, where you have to maybe make a diagnosis or a treatment plan, clinical decisions. You'll get the case history, dental charts. You may get x-rays in this part, photographs. So this is the part where you'll have a patient information or a patient with their information. And based on that information, they'll give you questions, and then you'll have to answer and make a diagnosis and make decisions. In the radiographic interpretation, usually you just get an x-ray, and you just have to tell them what you see on this x-ray, okay? And they'll bring to you a multiple choice question where there could be more than one answer. So they could sometimes say, choose one answer, right? Or they may say, choose one or more. So you really want to pay attention to this. This is one of the main things. If they say choose one answer and you choose more than one, you automatically lose that question, okay? And if they say one or more, then you may have more than one answer, but sometimes they may bring a template or a question that's usually one or more, but in the exam, it may come as only one answer, and this is something we'll see, and you'll probably understand it more once we get through the questions, okay? So those are the two parts. Now on their website, they say that this is how it's split, but you don't want to rely on that 100%. You want to study everything. And we'll go through all the topics moving forward. And to use our website and to use the ACJ platform, we have a video. Please go to how to use the website so that you understand how to navigate the mocks later on, and also the videos and the files. And if there's any issue during the mock or just before your mock exam, maybe go in and review that video so you don't have any issues there. Okay, so the clinical part, they'll bring you patient information. This is how it would look like, okay? They'll say, using the information provided, answer questions, okay? Could be from whatever number to whatever number. And they'll bring you a patient history information. So here's the patient's name, the address, right? Their address there, the age, for example. This is how it always will be, okay? This is the format they'll bring. Now, this part will change, obviously. Not everybody's going to be this age or this gender. So this part will change. And this will give you information to help you diagnose. So, for example, what could you use the age for? The age will help you diagnose aggressive localized periodontitis, if it's there. Sometimes it could help you diagnose primary herpetic gingivostomatitis, because usually that happens in children. So blood pressure here could help you decide if you need to refer the patient or not. You need to limit epinephrine. The temperature will give you information, right? So that you decide if there's fever, and fever will help you make a decision if you need antibiotics, depending on the type of infection. So all this is just information. You have to put all these dots together and connect the dots to come up with the proper decision and treatment or diagnosis. Okay. For example, here's the allergy section. So none here, but they could be allergic to penicillin, to codeine, to latex, to sulfite, to sulfa. They'll put it in that section. If they have any medical diseases, they'll put it over here where it says significant findings under medical history. And then current medications are the medications they're taking right now. And mainly you want to see also the chief complaint. Why are they here? And if there's any history associated with that. And what's their dental history? Do they usually come to the dental office? Do they have issues? When was the last time they came in? You'll see all this information. And then you have the social family history here, which might say if they're smoking, if they're married. And then you have the clinical examination. So they show you if there's any extraoral findings or intraoral findings. And sometimes they may just put here see photo, and then they have a photo for you, like in pathology. So they may not describe the lesion. They may want you to describe it yourself, okay? They may want you to know what the lesion is from looking at the photo, okay? They're not going to tell you it's, a large red lesion. They want you to see it and decide that it's large. So it depends on what they'll bring you here and how much they want to help you, okay? Things that in the extraoral, for example, you could look at lymphadenopathy, swelling. These will help you also decide if you want to give antibiotics. So this is the most important part. You always need to come back to the patient info, okay? Now we're going to come back to this just to kind of go in more detail, or just to kind of review a few things again, okay? Now, once they give you the patient info, they're going to start giving you questions about this patient, about the case. Now, each question, it may again say, as I said, it could be one or more correct answer, or it could say only one. Now, you cannot receive more than 1 mark per question. You cannot receive less than 0 per question. Okay, those are the rules. So, this is a radiographic question. There's radiographic evidence of caries on which teeth? So as you can see, based on the x-ray that's not here right now, but based on an x-ray, the answer was distal of 3.5, distal of 3.6, and distal of 3.8. And the way they distributed the mark was 0.3, 0.3, and 0.4. So if you selected all of these, you would get +1, right? So that means for this question, you got +1. And if you did that for every question, then you'll get a perfect mark, okay? Now, if you answered only this one, right, and this one, then you get 0.6 of the mark, okay? So you'll get 0.6 out of 1. So that's where you lose some marks. You lost 0.4. Okay, that's fine, as long as the overall is a passing mark. Now, let's say you answered this one, this one, and also this one. So you get +1, but you also answered this one. This is a -1. So now -1 and +1 will add up to 0. So you lose the question. Okay, you lose the question. Okay, so you don't get any marks for this question if you answer one of the wrong ones. What if you answer these two? So even though these two are -2, you cannot receive less than 0 per question. They won't take marks out from other questions. Okay, so if your mark so far is 50 and you came to this question, your mark will either stay 50 after this question or become 51 or anywhere in between. You cannot lose marks from other questions because you answered this question wrong. Okay, so it's either you win the question and you get a 1, you lose the question, you don't get anything, or you're in between. That's it for each question. Okay, so even if you answered all 3 of these, your mark for the question will be 0. Okay, now if you some options, because they're neutral, they're not the correct ones, but they understand why you answered them. So they understand that it looks like maybe carries, but they won't punish you for it, and they also don't want to reward you for it. They'll be 0, which means you don't get anything, but you don't lose anything. So if I answered, let's use a different color. So let's say I answered this option, this option, this option, this option. What's my total? I would get 0.6, okay? Because these ones have 0 points, but these two have 0.3 each, so 0.6. So I need to answer the ones they want me to answer. And the ones that are, tricky, they might just put a 0 on it, meaning you don't lose anything if you answered it, okay? You only lose marks when you answer something you're not supposed to answer, okay? When there's a negative marking on it, a -1. Okay, I hope that's clear. So the most you could get per question is a +1. That's the most. Which means, what if one option was marked 0.8, another one was marked 0.2, and another one was marked 1? So sometimes there could be 2 correct answers. Sometimes you could have multiple ones. So if you answer 2 of them, you will not get +2. The most you could get is a +1 on each question. The least you could get is 0. Okay, hope that's clear. So that will help you understand that the ACJ is a bit of a game here. Okay, it's something where you may have to compromise. You may think, you know what, I'm answering this one. If you're sure, I gotta use a different color here. Let's choose green. If you're sure of this and this, and you're not sure about this, so maybe it's better not to choose it because you might lose a mark. You don't know. So here with these two, you would get 0.7, which is decent. Okay. So that's why you have to measure or weigh your risk. So if you're suspecting 2 answers, if you're sure of 2, if you're sure of 2 out of 3, pick the 2 only. But if you're suspecting 5 and you're only sure of 1, right, then you should pick more. You don't want to pick 1 out of 5, right? But if you're suspecting 2 and there's only 1 more that you worry about, then maybe don't pick it. Let's say you're sure of 4 answers. You're sure of these 4 that they're correct, right? And then there's a 5th one that's bothering you and you're like, I'm not sure of that. Don't pick it. 4 is good. If you have 4 answers, usually if I have 4 sure answers, there's no reason to look for more, okay? So if you have 3 to 4 answers and the more is kind of bringing you into an area where you might be worried, then don't answer it, okay? So you'll be practicing all this during the course where you have to manage your own risk. You have to see when is it worth to take a risk, okay? Now, when it comes to periodontology in the exam, the NDEB is aware that the American Academy of Periodontology has published a new disease classification. So there is a new disease classification that was published in 2018 where they actually took out aggressive, right? There's no term for aggressive. We call it now a molar incisor pattern, which is pretty reasonable and logical. However, the NDEB the exams for all NDEB exam and assessments for 2018, and also there's another note for all the exams that the NDEB is doing, are based on the 1999 classification. So even though there's a new classification, the NDEB is not using the new classification until at least now. They have an announcement that's saying not only 2018, but even all the other exams, they're not using the new classification. Okay, so we do have a video explaining the new classification. It is in your book. There is a video. If you want to watch it just to learn, that's fine, but it's not being tested. They're not testing you using that classification. They're going to be testing you using the 1999 classification, which we will go through as well, and which you studied most likely in AFK. And they will bring you a periodontal chart, and that's what it looks like. So a periodontal chart looks like this. So here's the buccal surfaces of the teeth. They'll bring you the teeth, 2, 3, 2, 4, 2, 5, 2, 6, 2, 7, for example. The buccal, and there's a mesial buccal probing, a buccal probing, and a distal buccal probing, you see? And the same for the lingual. Lingual, mesiolingual, lingual, and distal lingual. And they'll give you the probing sites or the depth here in this row. They'll give you recession in the second row, and then they'll give you bleeding on probing. And the way they indicate, they just put a dot. So if there's a dot, it means there is bleeding on probing. If there isn't anything, there's no bleeding on probing. If a tooth is extracted, they'll bring these lines. So this means the tooth is extracted. And usually they'll say, or at least in the protocol, they say that this quad represents the entire mouth. So this is how the mouth is. But you make the diagnosis based on what you have here, and we'll take examples of that in perio. Then you have mobility and furcation involvement as well. Okay. So here's another example of the perio chart. Endodontics, the NDEB examination and assessments use terminology adopted by the American Association of Endodontics in 2009. That's the terminology they use. Antibiotics, the NDEB is aware of most current guidelines. So that means when it comes to antibiotics, the NDEB will use the recent guidelines. Okay. So for example, joint replacement, we used to do prophylaxis for joint replacement, but now we do not. So the NDEB does not want you to answer that we do prophylaxis for joint replacement, right? Because they used current guidelines for prophylaxis, which we will study in detail. And that's it. So that's an introduction. That's pretty much some tips about ACJ just to begin with, and you'll probably start to understand this more as you go. Okay? Know your limits. Don't try to perfect it. Okay? So when it comes to ACJ, the AFK mentality should go away. You should try to get high marks, but also you don't have to get 100%. When you become okay, or when you accept the fact that you don't need to get 100%, you start allowing some of these options to go, like we said here. Okay, so if I answer 3 options out of 4, I'm happy, I'm good. I could pass with that. Okay, I don't need to get 100%. I'll get the most I can, but without risking or without doing risking too much. Okay, it will rely on judgment. Okay, so it's not something you could memorize. You will memorize stuff, but you can't always. It's not a black and white thing. It is. There are some gray areas. So when you're in the exam, you might see me answering certain options in some cases and other options in some cases, and it just depends on your judgment because each case is different. You might feel differently about one patient than another because they might have more problems, or the way they're saying or they're mentioning the question, or the way they represent the chief complaint. So you have to use your judgment. That's why it's called assessment of clinical judgment. As long as all our judgments is close, let's say you're within 80% of judgment, that means you'll pass. But there are some areas where you're going to have a different answer than me, than this other person. You're going to have where you might disagree. But there are things where we all have to agree on, and it's maybe around 80% to 90% where we know what the answer is, but there's areas where we'll have a little bit of disagreement. That's fine. You want to read the case carefully, the patient information in the beginning. Review it after almost every question. So when you read the case, you most likely will forget the information in the info, the patient info. You'll forget that, and then you go to the question. What you want to do after you read the question, you want to go back to the case. Always go back to the patient info. It will help you answer. Sometimes we may read the question first and then go back to the case. So if there's only one question for the case, it helps to read the question and then go back to the case, just because you'll know what you need to extract from the case. You might read the case and it takes you a long time to read all the info, but you really only need a section from it. Let's say it's like they're asking you patient management. You only need the medical history maybe, or some other things. So you could exclude what you want to read from the case. All right, so our topics that we're going to talk about in ACJ: investigation and patient management, oral pathology, diagnosis and treatment, periodontics, diagnosis and treatment. Endodontics and ACJ, they only have the diagnosis template, so it's mainly diagnosis. Pharmacology has been switched now to prescription analysis and correction. So you're going to have to see a prescription, learn how to correct it, or see or spot incorrect concepts in a prescription, or errors, let's say, in a prescription. Local anesthesia, basically the techniques. There is a calculation template we'll go through, but it's not coming in the exam. So, but we still have to go through it. Medical emergencies, both diagnosis and treatment. Orthodontics, there are many templates, but it's not a big chunk in the exam. And this is the part where I tell you, do not focus on ortho, because you're going to see everyone has a different way of looking at ortho. It's very subjective, and if you dig too deep into it, you'll get lost. But what happens usually is in the exam, they'll bring you a straightforward case, try to solve it, and try to get the most out of it. People don't fail because of ortho, they fail because of other things, okay? Then radiology, which makes a huge chunk of the exam, so we'll be heavily focusing on radiology. And also radiology is subjective. So one person could see a cavity or caries, the other person doesn't see it, right? But there are caries that everyone will agree on. So you're 100% sure that this is caries. Everyone else will be. There's spots where you're 100% sure there's no caries, right? And then there's those spots that are 50-50. So what you want to do is you want to try to choose the 100%. And then if you have 2 or 3 of these, you don't need to choose a 50-50, okay? But if you don't have any things that you're sure of, then you could choose the 50-50. We'll practice all this stuff and talk about it more as things go on. So let's again look at the patient info. Remember, you want to come back to this after every question. And we talked about temperature, blood pressure, for example. Age could help in diagnosis. Allergies could help in the patient management template in question. Here could help you decide if you need antibiotics or not, for example, or other things. And another concept is to look at the vital signs. So you have blood pressure, heart rate, respiration rate. And usually in an emergency, in a medical emergency, they give you different numbers. They tell you, oh, look, the patient's blood pressure is now this over this, and their heart rate is this. So you want to compare it to this section. So these could help in medical emergencies to compare to see what happened with the patient's vital signs. Okay, so that's how you're going to use the patient information. And so, for example, age, gender, height, weight. The blood pressure should be this much, 120/80, just some normal values. And we said it could be used for knowing how bad their blood pressure is. Can you do treatment or not? And what's their normal baseline? So in medical emergencies, you could compare with. Pulse rate usually comes normal, and you could the main thing is just to compare with when you have a medical emergency. Respiration rate is like that as well. So there's not a lot of information you extract. But the main two is blood pressure, because it changes. You learn things from it, and you could apply that to the templates. And temperature, because you want to know if you want to give antibiotics and if there's an infection. So these two are things you really need that will change your answers. The other two, the ones in the middle, are mainly just to compare with when you have a medical emergency. So you want to review the history with every question. Consider reading the question first if just only one question for the case. If there's more than one question, then read the history first. But if there's one question only, read the question first. So it will save you some time. It's a good way to read the history quickly, read the question, come back to the history. Again, we have the chief complaint, history of chief complaint, dental history, medical history. which means what medications are on, the allergies, and we went through all this already. So for example, the medical history, they could have diabetes. These are common things: hypertension, angina, previous myocardial infarction, asthma. They could be HIV positive. They could have hepatitis, pregnancy. They could be pregnant basically, or they could have thyroid problems. So these are all things that you'll see or you may encounter in the medical history, which we'll talk about in the patient management section. So that's all in the medical history, where they say significant findings. Okay. And then here you have current medication. They could be on different medications. So for example, if they're on a statin, that means they have high cholesterol. If they're on a sartan, which is an ARBs, which is an angiotensin receptor blocker, and if they're on a pril, which is ACE inhibitor, captopril, these are antihypertension pills. So you want to know these names. They're not going to tell you the patient is on antihypertensive medication. They're going to tell you the patient is taking captopril, right, or losartan. You have to know what that medication is. So that's why when we were in AFK, we really focused on the names. Okay, so that's going to help as well. So you want to go back and read those if you have problem with them. So some popular ones, for example, propranolol, which is beta 1 beta 2 blocker, used for it's a beta blocker, so it could be used for hypertension, but not mainly for hypertension. It's usually used for other reasons, but for cardiovascular or for example, congestive heart failure could be used there. Metformin is usually in diabetes, so it's an oral hypoglycemic. Dilantin or phenytoin, which is in epilepsy. Advair, which is in asthma. It's usually a mix, or it's salmeterol, so it's a beta 2 blocker. And then you have budesonide, which is a steroid, which you could see also in asthmatics as well. So just know those things. Medical history also has allergy section, so they could be allergic to penicillin, codeine, sulfite, NSAID, or aspirin. And we're going to discuss what these mean later on in patient management, and what you apply or what you would answer when you have these things. So that's pretty much it, guys, for the introduction. Now you could move forward to the next video.